We have developed one of the first microsurgical systems for ophthalmic applications for assisting eye doctors to perform retinal surgery.
Professor Dr. Mohammed Ali Nasseri, who is the surgical robotics professor at the Technical University of Munich, was selected for New Generation Star Project at IROS 2024, launched by NOCOV for his academic achievements.
So the main challenge is the challenge which associated to the acceptance and the trust. Acceptance is coming from the need, what is needed in the clinical practices, and the trust means how safe the systems are. And the acceptance and trust should be addressed by the clinician and also to the patients. These are the main issues that we are currently facing to integrate or translate the surgical robots into the daily clinical routines. At the moment, instead of looking at the surgical phases, we are looking at the entire surgical procedure from the beginning to the end. So we look at the entire scene, and we are planning to automate the entire procedure, not only the surgical phase, but preparation phase, finishing phase, taking the patients out, anesthesiologists, and so on. This is the work that we are currently focusing on. We have developed one of the first microsurgical systems for ophthalmic applications for assisting eye doctors to perform retinal surgery, which is one of the most delicate clinical requirements or tasks, which currently we are doing using the robots. We are utilizing the motion capture technologies in order to create the entire scene understanding of the surgical scene, in order to localize the robotic platform on the patient and to localize all the devices in the clinic. So we could achieve in real time a 3D reconstruction of the room using the IR trackers and the motion capture technologies in order to make it more optimized and also more reliable for the clinical staff to bring the robot under the patient in the right approximation and taking it out from the surgical scene. In my opinion, the 3D scene understanding and the visualization and perception is the future in the surgical robotics. So doing it in a precise way and in real-time way is the future in this way. We have tons of surgical robots which are sooner or later coming into the market, coming to the clinical practices. But we need to utilize them. We need to integrate them in the clinical routine in a patient-specific, surgeon-specific, and procedure-specific way. In order to do that, we need to have a good understanding of a surgical scene, and the understanding of the surgical scene needs a surgical perception, operating room perception, and a tracking, visualization, observation technologies would help or facilitate this understanding for us.
As Ali said, it's all about like minimizing the preparation time for robotic surgery.
It's only a few seconds, which saves a 45 minutes time.
That's the thing. Yeah, there are other robotic systems. They need like an hour to prepare. And it's not worth it.
That means the current clinical practice cannot answer all the clinical needs. So we need the robots to assist hands to hands to the current clinical practices to address the challenges that we are facing in the very near future.